don't look at me.
Okay.
You look at me. I'm going to come sit right here.
Okay.
I want to just actually do a mic check first before. So what I'll have you do is just say and spell your first and last name, just so we have that whenever you're ready.
Okay.
Yeah, just
look at you right here, or
oh,
here?
You can. This part is just for the mic check, so that doesn't matter. So you can just
Carrie Hall, Carriehall.
Perfect. Do you want to just flip your coat under again? That side keeps flipping out. There we go. There.
Should I button it?
No, it's fine.
Okay.
Perfect. And you can just look at me. Like I said, nothing is live, so if you want to repeat anything or anything like that.
All right.
Talk to me a little bit about, I think there's a lot of moms out there that are feeling pressure and anxiety around this whole thing of breastfeeding. Talk about that a little bit of like what you have seen and experienced.
Okay. I think what happens is we are pregnant and we have this idea of how breastfeeding and motherhood's going to go, and we really have this high expectation and that we want it to be perfect. And then we have a baby and we realize how hard it is, how much we're not sleeping, how much we have to recover from birth as well, and our hormones are up and down, and we're just in this really vulnerable place, and we're trying to learn something new that we thought was going to be perfect. A perfect latch right away, when more often than not, it's more of a learned process. It's a kind of a back and forth that you and your baby have to learn together. And I wish that message was more put out there, because it really sets moms up for feeling like they're failures right away.
And I think there is, like, do you think that I think there's a range, right? Like, I've heard there's a range. Some people actually breastfeed really easily. Some babies breastfeed really easy, and some do not. Is that true? Is there kind of a range?
Yeah, there are definitely those lucky moms who the baby comes out and they latch and it's all good, but that's definitely more the exception in my experience than the norm. And it usually is a challenge, and we're dealing with anatomy on mom, anatomy on baby. There's a lot going on there. There's mom's health history. There's a lot of things that go into how much milk we're going to make, how the baby's latch is going to feel.
So when a baby is having a hard time latching, or it's not, going as the mom wishes it would, what are the mistakes that sometimes, or not the mistakes, but what do moms sometimes do that may not be the healthiest thing?
Or a learning process.
Exactly.
I don't like to think of them as mistakes, because our moms are trying everything that they can do. They're working really hard, and then on top of that, they're feeling like they're not doing a good enough job. So I try to really encourage them and teach them. But one thing that they might be doing is just not letting their baby open wide enough and get a really deep latch. A lot of sore nipples just comes from that. It's just not the correct latch on. And a little bit of soreness is fine in the first couple weeks, but if we're talking like really bad nipple pain, skin breakdown, scabbing, bleeding, that is not okay, and we want you to seek help right away. We don't want you to think that that's just a normal part of the process. And we want you to get help in the hospital. Your nurses are fantastic resources. There's lactation consultants, midwives. Come see one of us, talk to us, and let us help you and get you help right away.
And going to a professional is healthy, but maybe going to some other sources, social media, or looking, there are places where there's some discouragement maybe. In some of this, of what kind of things are going to heighten the anxiety and the discouragement and those kind of things?
I think really just feeling like we have to be perfect and that we have to have a perfect latch, and if it doesn't go right, then there's something wrong with our baby or something wrong with us. And let me start that over.
No, you're good. And maybe talk a little bit about where they find that. Like, talk about social media a little bit.
Okay.
If that kind of fits in.
Okay. Well, where social media can be great is a sense of community and getting to share with one another. Where it kind of goes a little bit sideways is the idea of perfectionism. Is this highlight reel that we're looking at and thinking, oh, why don't I look just beautiful and touched, and like these photos that we see on Instagram. And the reality of it is that it's really messy, and it's sleepless nights, and it's sore nipples, and it's hard.
Yeah. There's a lot of range probably with moms. And I mean, I think sometimes we think we're either doing it right or we're doing it wrong, right? But there's probably a lot more. I mean, as a nurse, you probably experience a lot of different scenarios, you know, that moms go through.
Yeah, and it's a work in progress with each mom. Each mom that comes in, I try to evaluate where she's at and what plan is going to work for her. It's not about doing everything this way or that way. It's about what works for her and her baby and feeding her baby.
So talk about maybe a few tips that you have. Obviously, you mentioned like go to a professional, you know, talk to a professional if you're having a lot of trouble. Are there other things that moms can be thinking about and working on at home if they're struggling or if they're, you know, going through this learning process?
Reach out to their other friends, their breastfeeding moms, their mothers. Reach out to, there's lots of great groups out there where you can find support that are positive. And I would look for a group that's not trying to make you conform to one way or another, that accepts all types of feeding and breastfeeding bottles, just really inclusive. Like I mentioned, PEPs, I like MOPS. Evergreen Hospital has a great group with new baby classes and new baby groups, and that goes all the way through toddlerships. You can meet other parents that way. There's also Fit for Mom, which is another group that's really great, gets you outside, exercising, fresh air, and you meet all kinds of moms in different walks of life. So I think just talking and supporting each other and finding those people that you can trust that are going to encourage you and tell you that you're doing a good job. That's what you need in your life during this time, is you need so much support.
I think when we think about, I mean, we're in a stage, I think that moms are, I hope that moms are being more vulnerable about this, right? Like that more moms are sharing experiences that, I mean, have you seen that in the mom community, that there's a little bit less mom shaming, that there's more acceptance of however you're doing life and however you're doing mom life is okay?
Absolutely, absolutely. And I just want to tell all the moms out there that you're doing a great job and you do you, and we're all accepting of you, and we all want to accept each other.
For some moms, is breastfeeding just not going to work?
Unfortunately, yes.
And what does that mean? I mean, that's just part of life, right?
Well, you know, some moms who maybe they've had previous surgeries, or they have health conditions that make making milk a problem, or maybe baby's got a really difficult latch to work with, and yeah, maybe we get to that point where we're making some breast milk, which is great, or maybe we do have to, you know, supplement. And I just encourage those moms, and just they're feeding their babies, and their babies are healthy, and they tried, and they did a great job. I mean, whether you are trying to breastfeed for 3 days or 3 years, really, I think it's incredible.
I love it. Anything else that we haven't talked about? Anything else we should mention?
Well, I think one thing that I want to get out there is the reason why I talk so much about support and community is because when we don't have that, and when we have social media and we have these this perfection reel going on, it oftentimes makes moms feel like they're not good enough, and it makes moms feel guilty, maybe that they're making choices that they didn't initially plan on, whether that being a birth that they didn't want, or maybe having to supplement. They didn't plan on that, and that makes them feel less than, or like they're not doing enough for their baby. And so that can really lead quickly, especially with all the hormones going on postpartum, and with all of that vulnerable state that we're in and no sleep. It can really easily lead us to postpartum depression, and including anxiety. And so we find these moms having a really difficult time. The incidence is about 1 in 10. I've also read other studies, it's closer to 1 in 5 women that deal with these mood disorders. And so I just think it's so important that we get help from professionals, and that we talk to each other and have that courage to speak up and tell your providers that you're having a hard time, and to normalize that.
Right, because there are physical, you know, results of some of this stuff. Like sometimes I think one's like, oh, I just got to keep, you know, going, or or that I just need to read more and I just need to dive into that rabbit hole a little bit deeper. But I think, what I'm taking is that you're saying that's actually maybe not going to be the healthiest thing, in a world where we have information all the time. That can have kind of a dangerous result.
It can.
Anything else? What haven't we touched on?
I just want to make sure we get in camera what you were saying before about it's feeding your baby. All that matters is that you're feeding your baby and your baby gets fed, and you can try, but respect yourself for feeding your baby. I don't know if there's a question that can lead to that, but the way you said it really touched me earlier.
Yeah, okay.
Yeah, when we're talking about the health of the baby, and the health of the mom, what are the most important things here?
I like to say, people like to say breast is better, and I like to say fed is best. That your baby is fed and that you're healthy mentally, physically, and that your baby's healthy. At the end of the day, that is the most important thing.
Love it. That was perfect. That's great.
The other thing you said earlier that I thought was really good is the difference between talking to someone you know and a professional versus getting advice on the internet is they don't know your circumstances. They don't know your situation. I think maybe adding some of that background of no matter where you're going on the internet for help, they don't know you. They don't know how hard you tried or what your background is or what your situation is. And I think some of that was really, really powerful.
Yeah, so maybe, I guess, as people look to resources, what is the difference between going towards the internet and going towards somebody like a professional or someone who is aware of your background?
Well, a professional is going to help you know you for who you are and what's going on with you, and maybe help come to a better problem solving a lot quicker. We're going to be able to take a look at your situation and help you quicker. And we're also just going to be able to help you discern what's the fact versus what's anecdotal. So let me go back. We're also going to be able to help you discern between what's the fact and the good information and what is just hearsay and stuff that doesn't really apply to you.
And as people go to professionals, sometimes I think moms are they're waiting maybe too long, not too long, but I guess, why do you think sometimes people don't reach out to professionals? Why don't they automatically say, well, I'm having trouble breastfeeding, or I'm worried that it may not be going well? Why do they go here rather than there?
I think there's a lot of shame as far as I feel like I should be doing better and I should know better, and why can't I make this work? And they try to do it themselves first, and they just delay that care. And when a lot of times I feel like I wish I could have helped you a week ago and saved you maybe a week of discomfort, or helped you get on the right track.
So you guys are here and you want to help.
Yes.
You guys want to be there, and I think that if a mom's sitting at home right now and they're holding back a little bit, what would you tell them? What would you tell them if they're not quite haven't taken that step yet?
Just, it's a phone call away. Call someone. We're here to encourage you, to help you, to get you the tools and the resources that you need, to help you just get through these days. They're really hard, challenging days, and just take it day by day. And please call for help. We'd love to see you.
I like it. Anything else?
What are some cautions?
Yeah, please.
Yeah.
We should talk about cautions for people who are Googling their symptoms. So let's say your baby's not latching, you're going to Google not latching, you're going to get some page telling you something. What would you tell someone that's thinking of Googling their symptoms?
Yeah. Okay. Because you asked me a similar question, and there was something on the tip of my tongue that I was going to say, and
there was something there.
Yeah, and I didn't say it. Something that had to do with that vein of, you personally, we kind of help you kind of muddle through all of the, and then also I think what happens is that you get into this rabbit hole of forums and discussion boards and pictures and people who are not medically trained, and they're posting pictures of all kinds of things, trying to diagnose each other, and that just gets scary.
Yeah, and so are there other I'm trying to think of, like, is there a don't list, as far as we're like, okay, when we're struggling, what are our do's and don'ts? We should, try this, we shouldn't try this.
Okay, we should try to get some sleep. That's number one. Are you sleeping? Eat something. Call in your resources. So have your partner help you, your mom, brother, sister, whoever can come over and take out the trash, anything like that, so you can get a little bit extra sleep. I'd also say call for some help. I'd also say, use some nipple creams are great. Making sure your latch is great. Coming in right away, especially if you've been discharged home with a nipple shield, please come in within, if you can, in the first week. We can help you work through those things. And also, another thing is to protect your milk supply. A lot of times, babies get started on supplementation early on. There's a lot of medical reasons that happen, or jaundice, or weight loss. And I would just say make sure you talk to somebody about a plan if that happens, so that we can make sure you're pumping or expressing your milk, so that we don't get behind on your milk production. So that once all of that medical stuff's resolved, we can work on breastfeeding.
Okay, how about the don't list? What should we avoid when we're struggling?
Don't compare yourself to others. Don't try to pump every hour and not get any sleep. It's hard to say don't, because I
maybe
have to be
so
so encouraging.
Right, but don't, go down that rabbit hole, right? Don't go to the social media, Google,
Yeah,
that world.
okay. So don't start Googling all your symptoms. Don't get on message boards and forums, and don't seek that help you need from places that aren't medically, knowledgeable, or places that can be negative. There's a lot of places on the internet that say you have to feed this way or feed that way, and those can be really damaging as well.
Go to people who know what they're talking about. Okay, I'm trying to think if there's anything else that'll help us move through this. You mentioned this before, maybe it's just worth hitting one more time, just about that support group, about finding a group of women, other moms, or family members, or people. Why is that going to be important? What does that look like?
Well, number one is partner support. We know with research that that's the number one thing that keeps moms breastfeeding, is a partner that supports it. The support of others is huge. The support of our community, so that we go out and we try to breastfeed in public, that we're supported, that we're not glared at, we're not kicked out of restaurants. I mean, these things have happened, and it's devastating. So just as a community, when you hear that toddler having a tantrum in the grocery store or on the airplane, being a little bit more kind and understanding that you're not walking in that mother's shoes right now, and that she's dealing with this a lot, and really trying to support those mothers that are out there and trying to breastfeed. It takes a lot of courage for moms to do that. Oftentimes they're practicing at home, they're trying to find a position where they can breastfeed in public, that they're not too embarrassed, or not showing enough skin, and so you find these moms, they're finally getting up the nerve to go out there and do their thing, because they can't be stuck in the house. That's isolating also, and we just need to rally around them, support them, check in on them. If you know a new mother, call her, text her, ask her what you can do for her, ask her really how she's doing.
This is more, I'm just curious, honestly, as like a single person who hasn't had kids, who hasn't breastfeed, but has heard and wants to support and wants to like be out there in the community, like cheering them on, what can I do as I'm walking around and seeing this? Is it worth like going up to them and being like, you're awesome?
Yeah.
Go?
Oh, I would have loved to have heard that. Yeah.
Okay.
That sounds great. Ask them if they're in a restaurant, ask them if they need some water, or ask them if they, that's a great idea. And just being open in your mind that there's a lot of families around and a lot of people that we can support.
Cool. I think that's all the questions I had. Did you? Okay, I'm just gonna check my list and make sure I checked all the things off that I think we wanted to hit.
I think I'm hearing so much the positivity of your practice that when you get questions that are like, what are the don'ts? Or you get questions
we'll
that
be
are
careful
negative,
with those
like
too.
your positivity.
I am. That's how I call myself a cheerleader. Like you just have to. I spend half my practice just like, let's put the baby away and how are you doing? Because that's a good amount of my practice.
And maybe that's something just good to hit real fast.
Or
just
say on camera.
In a sense of the positivity of what this whole process should look like, you know. I guess the question would be, you are so positive, clearly. Why is that, and why is that important for you?
Just because I think patients need it. Everybody needs it. They need to be told that they're doing the right thing, that they're doing everything that they can for their babies, because they come to my office and they're crying and devastated, and these moms aren't sleeping. They are working around the clock. They're working harder than anyone I know, and they still feel like they're not doing enough. So that's the point in my practice where I encouragement overload. I just feel like they need to hear that they're doing it right. Especially when we have all these messages out in the community and social media that tells us that we're not perfect and we're not okay. They need to hear, especially in this vulnerable time, that they are doing well. And they are all super women. I'm just so proud of them that they're trying, and they just need to know that. I spend a lot of my practice just, okay, let's put the baby away. How are you doing? Because a lot of it is that. And if we don't support and encourage our moms, that's when they can start to really get into trouble with the mood disorders. And so I just think it's so important that they feel supported.
Because it's not like a formula, right? It's not like if you do this and this and this, then it's going to be perfect. You know, that relationship that you guys have seems like that's going to be.
And it really isn't a formula. Every situation is so different. And every mom and baby have a unique circumstance that they're working with. And I just wish that we can all understand that. So it's not just all pressuring each other to do motherhood a certain way or another. We just need to embrace each other.
Perfect. Well said.
Yeah.
Is that okay?
Yeah.
All right.
That was great.
Awesome.
I'm just like positive.
Yes.
All the positivity.